So, welcome everyone back to the Performance Prescription Lab podcast, where we dive into the intersection of sports, health, and performance. I'm your host, Jessica, along with my co-host, Neilham. And this is our final Paris 2024 episode, and perhaps the most special one for us. With this episode, we are celebrating also World Pharmacist Day, hosting two incredibly knowledgeable sports pharmacists that we're also very thankful to call friends.
We have Claire May from the United Kingdom with us at the moment, and we are going to have Somer Helvacı from Türkiye, who both volunteered at Paris 2024 Paralympics pharmacy services. They are pioneers in sports pharmacy, and we are very proud of our colleagues, our friends. We will be exploring their experiences, insights, and how sports pharmacists play a pivotal role in supporting Paralympic athletes. Let's dive in.
So both Somer and Claire are very busy pharmacists with their patients and school and everything. So we are kind of going to have Claire first, and then Somer will join us in a little while. So welcome everyone again to the Performance Prescription Lab podcast. Welcome Claire, mostly. Thanks for being with us on this special World Pharmacist Day. So can we start by letting everybody get to know you a little bit?
Well, I think that would be okay. So my name's Claire May. I'm based in the UK, as Neilhan said, but I'm actually in the south part of England, near the coast in a wee place called Brighton, which is really special and really lovely to be in. Brighton's been home for 27 years and has been the biggest part of my pharmacy career yet, because I studied here in 1997. I achieved my undergraduate qualification and then my registration in Northern Ireland, actually, because probably noticed from my accent that I'm from Northern Ireland. So I went home for a quick year just to undertake my what we call pre-registration. It's now foundation year in the UK, but throughout the whole world there's a different term, so internship or whatever. So I returned to Brighton, and since returning to Brighton, I've had a number of wonderful experiences, including being a community pharmacist, which I still am. So I'm a proud community pharmacist with 22 years experience. I worked in primary care, which was an amazing experience, actually, because that enabled me to really see a different side of healthcare, where I supported other prescribers around their prescribing choices. So really got me to delve deep into, healthcare and healthcare needs. That led me then to collaborating with the University of Brighton and thinking about how do we ensure this lifelong learning as a focus for pharmacists. So I started working with the University of Brighton, eventually ended up here full time doing undergrad and postgrad education. And throughout all of this, which has been a backdrop, is the desire to volunteer. So a fun fact about me, so I've actually been volunteering, I realized when I counted back, since I was 13.
Oh,
so
wow.
It's always been something that I've really been drawn to. So in the UK, there are a number of different awards where you have to volunteer to get credits. And so I've volunteered in a number of different groups, whether that's been with a healthcare focus or whether it's just been fun activities. Yeah. And so I realize now, so many years later, I was going to say how many, but I'll let you guess that yourself. So many years later, that actually volunteering is still a big part of my life. So really leads into Paris 2024, which, came really off the back of having my first experience of delivering pharmaceutical services in London 2012. So yeah, that's a bit of a whirlwind about me. So the fun fact is I'm forever volunteering.
You're a professional volunteer.
Professional volunteer, that's right, Neilhan.
Claire, you've touched so many lives with your journey and being able to bring so many experiences forward from each thing that I find it incredible, your background and especially your passion for volunteering and giving back to the communities. So I think that probably leads in a little bit, and you answered our first question, your motivation for, but basically what's your motivation for volunteering in the Paralympics of Paris 2024, and how does that passion align with sports pharmacy? So how did sports pharmacy get wrapped into that?
So when that first kind of volunteering experience happened back when I was a teenager, I realized that you do get an awful lot of joy from giving back. And actually what it does is it broadens your network because you meet people that you wouldn't necessarily have that opportunity to meet. So I volunteered in a number of different groups where it was either supporting students how to play hockey. So I was a great hockey player when I was younger. Unfortunately, I'm not now, but when I was younger, I used to help coach and I really enjoyed that. Or it was arts and crafts, rubbish at arts and crafts, but love it. So, you know, I'm a passionate serial evening class, you know, to learn pottery, textiles, those kind of things. Anyway,
Love
I
that.
realized that it gives you so much, it's food for the soul. So I took that one step further once I became a pharmacist and started, I suppose, like taster sessions of different ways of being a pharmacist. Because I think we get fixated as pharmacists and think that you're either in this sector or you're in that sector. And sometimes we find it hard to find where our commonality is.
I
So
agree.
in a volunteering space, you can get that commonality.
Yeah.
So I went to, I don't know if you've heard of Glastonbury, it's probably one of the most famous music events.
That's an
that
amazing
happens in the
festival.
UK. It's huge. And actually, they also have volunteering opportunities for pharmacists. So in 2005, I took my first step into the world of music and pharmacy, and it was great. But staying in a field for several days is not me. So it was brilliant. It was a fabulous experience, but that then led to looking at other volunteering experiences, and London 2012 came up and I thought, well, that's a bit different, why not try that? And so I applied, and it is as easy as that. So for everybody out there wanting and thinking, oh, could I do it, should I do it, that application process is fairly straightforward.
Yeah.
So I would highly recommend it to everybody.
Yeah.
One of the things they do want to see is that you've got a commitment to volunteering, because there's no monetary remuneration, but of course you get that kind of meeting other people, those other benefits. So realistically, the motivation for 2024 was just, it's so good. And the network that you meet throughout it is just phenomenal. You know, I've just increased my network by several pharmacists and pharmacy technicians. I think it's really important. It's the wider pharmacy team.
Yeah.
So
Love that.
yeah, I think the motivation is just getting to meet more people.
Yeah, and I mean, I think if I am correct, I think I just saw that the winter 2026 volunteering applications just came out also. So if anyone's interested, definitely something, if you go ahead and try and start that application, as Claire said, it's pretty straightforward. So if anyone's interested, that just came out, I think just a couple days ago. So I love the story, Claire. I love it. And Neilham, I think you have our next question for Claire.
Yes, volunteering is pure joy itself, but while you are volunteering, you have responsibilities. And our area of pharmacy plus sports pharmacy for elite athletes have some certain regulations, especially in the case of sports, it's anti-doping rules. So, as a sports pharmacist volunteering, how did you ensure compliance with anti-doping regulations, especially athletes who are facing chronic conditions and who are receiving treatment, maybe that may require a therapeutic use exemption?
So that's a great question, because it actually starts well before you enter the pharmacy. Part of the delivery of a pharmaceutical services in a major event, the actual coordinators need to be thinking of that from the get-go. So there needs to be some way of clearly identifying those items that are prohibited or are likely to be prohibited, because we know, because we've been involved in the process of thinking about anti-doping regs for a while now, that, you know, the list isn't a static list. it changes, but there may be some drugs. So nice example is always salbutamol, because I think salbutamol or albuterol or one of those beta-2 agonists that we're using for very well-known respiratory conditions, we know is a real saving medication for those with asthma or COPD or whatever the respiratory condition might be. And used in its appropriate clinical indication is totally fine. But once you exceed the recommended daily dose, you are putting yourself at risk of having an adverse analytical finding. And of course, that's hard to kind of distill down. So there has to be something from the provider's point of view where they're identifying this, and that will happen through a formulary usually as well, which as a sports pharmacist, depending how you're networking, you may be able to influence at the point of publication. But to be honest, as a volunteer at a major games, you are working to the guidelines that are given to you. So how do we ensure the compliance? We have to have that awareness from the get-go to be able to identify those medicines that may or may not have a status of prohibited. Or we also need to work with our colleagues to establish that and make sure we're talking. But it's that communication between the athlete and the athlete support personnel. So on the documentation, certainly for Paris, we had very clear boxes that needed to be completed if it was a drug that was likely to be prohibited for that patient in that sport. And we would obviously discuss some of the issues that may crop up. And we also encourage them to be involved in the shared decision, because as you know, and those who are involved with sports pharmacy, the athlete is the sole person who's responsible for whatever goes into their body.
Yeah. I think that's really important that, you know, like I feel like sometimes it gets missed that it's the athletes that has the final decision and is the one that's going to take the fall if something happens. So, but that's really interesting. And just a side question on that. Did you get a lot of training prior to, or was it when you arrived on, what are the guidelines for how everything is handled in Paris?
So I think each games is different in its approach.
Gotcha.
Which brings its positives, because you get to see a different way of how things are delivered. And the real beauty of going to a different country to practice your own profession is you see the different ways of doing it. And sometimes that makes you go, we wouldn't do it that way. And then you realize, well, actually, there's a rationale for that. There's a rationale why things are different.
Mm-hmm.
And it doesn't make it any worse or any better. It's just different.
Yeah.
So the training will be very much set out by the organization and by who is responsible.
Okay.
And I've had different approaches. You know, I've had approaches where we've done a full-blown module, where you've had to show like completion of that module.
Okay.
To others where it's maybe less formalized and more around the processes.
Cool. I was just curious about that, on how that training went for those healthcare providers. But I think it's cool that you talk about, like, when you go to different countries and you work with different people, it's really interesting to see those different experiences and the different ways of thought. And like you said, no one's wrong, nobody's right, but sometimes it opens your eyes to positives, or you're like, oh, you know, maybe we should incorporate that, or how does that work in our country or in my practice? So I love that. Which leads me to my next question. Are there some takeaways from your experience that you think pharmacists working with athletes should know, especially if they're dealing with like high performance athletes, such as those in the Paralympics, or just athletes in general, that you learned from your experience?
I mean, the key for me is that really trying to make sure that the athlete understands why they're taking what they're taking, and making sure it is their choice, that there is that realization that there are potentially unwanted side effects. And I think, you know, I recently done a talk for a local academic group. And one of my slides in that was around, it's not all about doping. I think sometimes it's really easy to fall into the trap, isn't it? To think about sports pharmacy equals doping, or medicines in sport equals doping. And actually, it's not all about that. If you think just about something like a non-steroidal anti-inflammatory, so something that, you know, lots of people will be using for analgesia. You know, in the UK, it's promoted for very young children with fever or pain. And we use it without even really thinking about it. But actually, as pharmacists, we understand, don't we, the significant side effects of using something like a non-steroidal anti-inflammatory on our renal system. And if you're pushing your physical ability to the extremes, so you're already potentially dehydrating your body slightly because of the strenuous exercise that you're doing, and you add in another agent like an anti-inflammatory, you're really pushing your body to the potential of acute kidney injury.
Yeah.
But of course, no one thinks of that because ibuprofen is what you can just buy over the counter.
Right.
It's not on a banned list.
Yeah. I think that's important. I think, like you said, most people equate sports pharmacy to anti-doping, when there is a lot of education around medications that are used every day for, you, like you said, NSAIDs are, I think, is a great explanation. Proton pump inhibitors, I use that too, with, you know, nutrient depletions and different things. So I think, you know, making sure that we understand that sports pharmacists can work in all areas, and it's not only anti-doping, is beautiful. Nilham, what do you have to say to join in?
Well, I think from just your answer, I captured that the most contribution you've given is the caring for the athlete's safety, patient safety, patient athlete safety. That's, of course, we have to protect the athletes from anti-doping, but we also have to protect athlete safety because there are side effects, and of course long-term use of some medicines may hinder performance and health. So having that perspective at the highest performance level is very important, and it's very inspiring for us who are planning to, have aspirations to go in such events. And maybe I can conclude with that question. What advice would you give to pharmacists, aspiring sports pharmacists who would like to work in international sporting events, would like to work/volunteer in such events, such as the Paralympics? We have LA 2028 coming. We have the Winter Games coming. So I'm sure there are excited pharmacists who are listening to this episode. So your advice would be very helpful.
So I think the biggest piece of advice is, don't worry if you get knocked back at the beginning. Knockbacks are part and parcel of being an aspiring sports pharmacist. It just is, because the number of roles are not huge in number. They're getting bigger, and I think the stuff that you're doing, the stuff that the US Sports Pharmacist Group is doing, stuff that other colleagues are working through, whether that be through International Testing Agency or through advocacy. You might not get it the first time, and it's okay, you know. So if you don't get to do a sports pharmacist role in a major event first time, if they offer you something else, take that, because maybe doing chaperoning or driving athletes around will give you just that awareness of the things that are happening within those major events that will help you the next time you apply. And it's not always about major events either. You know, there's a number of local events that will be happening. And so reach out to local sports groups, your local soccer teams. Again, you might not get it first time, but that will hopefully help. So I suppose my advice is, be tenacious, stick at it, you know, network with people, And if you want it badly enough, it will happen. And the volunteering rule, I do think is great. I think it's a whole different area if we start to talk about jobs that are remunerated. That's a completely different thing, and I'm not sure that there's much I can say about that at the minute. Because again, I think we're doing this big piece around advocacy and raising awareness and reaching out to different groups to show the added value that sports pharmacist or sports pharmacy brings to the team. And I think that will follow.
I think that's beautiful. And I think it's kind of, I feel like your advice is very similar to what you give an athlete trying to start in a sport. Like if you don't get on the team the first time, keep trying, keep practicing, keep going to coaches. Like I feel like that is advice for, sometimes you're not going to always get the big, make varsity or make the Paralympics on your first try, but there's a lot of other things that you can be doing to give back and start building in that foundation. So I think it applies to both sports and pharmacy.
Yeah, it's a marathon, not a sprint.
Yes, for sure.
Yeah, I love that quote. And you're showing us different opportunities where pharmacists can volunteer at different events, whether it's a local event or it's an international event like Paralympics, Olympics. It's so inspiring. And it's also the reason why we wanted to do this episode. And we are launching this episode on the World Pharmacist Day. FIP, International Pharmaceutical Federation, is recognizing this day, September 25th. And this year's motto is Pharmacists Meeting Global Health Needs. I think from what you have just shared with us, also that's what sports pharmacists are doing, meeting global health needs for athletes all around the world. So would you like to wrap up with a final message to our listeners, particularly pharmacists, about your thoughts on the World Pharmacist Day?
Yeah, and I do think that global focus is so important when you think about sports pharmacy, because when you start to consider bringing people from across the world into a concentrated area, and we need to think about not just their own physical health, but sexual health as well. So I'm a real advocate of making opportunistic advice at the point of delivering something else. And one of the things that we've successfully done in a number of different events is roll in that sexual health awareness message and getting people to get screened, because the beauty of a major event is you have a number of multidisciplinary groups all in one place. And that multidisciplinary view and approach is fabulous, because you can really get the athlete to buy in and understand that it's a holistic approach, So whether it's your eyesight, whether it's your teeth, whether it's your physical being, or whether it's a bit about mental health, well-being, or your sexual health, you can bring it all together. So I think the beauty of the FIP focus on global health and being a sports pharmacist is you can wrap that in, and you can help with some of the messaging around, making sure that we're getting people screened, making sure that people understand what can be passed through sexual contact. So yeah, I think it's a really great way of looking at it. It's not just about the athlete and their sport. You want to treat them as a person as well, and they have all the same needs and desires as every other human being walking. Yeah. They are just phenomenal at their sport. It doesn't mean that all the other stuff is lost.
Yeah. No, I think that's amazing. I think, I love that they're honoring World Pharmacist Day and it's a global health message. I feel like sports brings so many countries and people together. I feel like by adding health and the whole person approach kind of mirrors that, like you said, you're looking at not only performance health, sexual health, well-being, spiritual health. There's so much mental health to being a top level athlete. But also that there's so many people that need to help support that. And it does take a whole team. It takes basically a global approach in order to have that. So I think that is a beautiful message. And we just want to say thank you so much for joining us today. I know you're super busy and have a lot going on, but taking time out to talk to our listeners and just spread the message of what you've been able to accomplish, what you're doing, and just all the so many positive takeaways from our talk today. So thank you, Claire. And I'm grateful to call you as a friend, a mentor, and all the above.
Excellent. Thank you so much.
Thank you, Claire, for being with us.
Somer, we're so happy to have you joining the podcast today. So welcome to the Performance Prescription Lab podcast, Somer. Thanks for being with us on this special World Pharmacist Day. So as our listeners, we would like them to get a little bit to know you. So can you give us a short bio and maybe even throw in a fun fact about yourself?
Okay, thank you, Jess. Hi, everyone. Hello, Nina. And really, I appreciate for this great and kind invitation because that was important. You know, we just completed the Paralympic Games, and I will tell some details and some of my experiences. But so I was looking for a spatial platform to share my experiences, and this invitation is really great for me. Let's start, and I want to introduce briefly myself. I'm of course, a pharmacist, and it has been, let's count, 25 years. By the way, 20 years of this experience directly in my own community pharmacy. After nearly 5 years, I managed to step out my comfort zone, and now I'm trying to improve myself as a lecturer, especially focusing on sports pharmacy expertise. And most of the time we have some common projects with Jess, with Ilhan, with and other colleagues all around the world. And what can I say? As last 4 years, I'm almost focusing on sports pharmacy lectures, special contents, some especially academical level programs. And as a result of all these studies, my biggest dream is just we came through, and nearly 15 days I was in Paris, and then let's talk about some about Paris.
What about a fun fact for our listeners? You have many fun facts, as I know your friends, but maybe one for our listeners to get to know you.
Okay, this is a great point. As you know, as a pharmacist, we have to be, I think, multi-skilled persons because we have lots of multidisciplinary education and lots of lectures. What about me? Okay, I am interested in music, in arts, fine arts, movies, and sports. But I think my first passion at the top of the list could be music, because from the very little ages to the present, I'm still also continuing to play maybe 6 different instruments. But what I think the most fun fact point is I don't know any notes or any technical information about how to play instrument, but I just try to play them from my ear, from my soul.
No, that's more than a fun fact. I think it's incredible fact.
Yeah, I was going to say, the fact you play 6 instruments and then you play it not knowing how to read music is incredible. And I find it really cool because Claire actually alluded to her passion for music and arts also. So pretty fun. I think you both have, and I secretly do art too. So I think it may be something all the pharmacists have as an outlet. But Nilham, do you want to go ahead and lead off Somer into our first question to get to know more about his Paralympic Paris dream experience?
So you were talking about the multidisciplinary environment we have when we were studying pharmacy or when we are practicing pharmacy. In the Paralympics itself, it was also a multidisciplinary environment. There were other healthcare professionals, also other athlete health support personnel in the environment. How was your collaboration with them? Did you face any challenges, or Were there any opportunities when you were working together?
For going to Paris, so I was wondering about the technical details because you know this is Olympics and Paralympics. This is the nirvana of this journey. According to our education in IOC drugs in sport course, you know, you already had this certificate, you know, and we had chance to study many different lectures about sports pharmacy expertise. According to these titles, I thought that there could be lots of steps and there would be some other difficulties about managing the system. But when I arrived to the polyclinic, to the pharmacy service, everyone was very cool and they were already solved the operational system because of the Olympics experience. They already put everything at the right places and system was ready. And for the first day, let's say it was the 20th of August, exactly 1 week before the Paralympic Games, at the opening ceremony, all the system was ready to get action. First day, they all invited us to a big convention center, kind of convention center, and they explained every important details about the operational system of polyclinics, step by step. For example, first physicians, first then the other experts, and finally the pharmacy service. Then we get a tour in the athlete village, and then at the next day, 21 of August, our mission started. And there was a really very complicated system and too many different expertises from other specialties, such as physicians, cardiologists, orthopedists, physiotherapists, ophthalmologists, and dentists also. And also there was a other radiology service, and they are all together. Everyone was full motivated, full concentrated, and everyone was ready to get action. We all has enough experiences, I think, because when I met with my other colleagues, especially with my French colleagues and other pharmacy technicians, they are all most of them from France, and they're all French experts. Except of French, we were just 4 persons, 2 from UK, 1 from Germany, and me from Turkey. And I think our main mission was to be a kind of bridge between the French experts and from other delegations. You know, there were more than 150 countries, delegations, and half of them maybe don't know any word of French. So we all communicated in English. Then we tried to transfer the information to our French colleagues, because you know there are also some official regulations and operations, and especially our French colleagues from the hospital pharmacy of Paris, and they are mostly responsible for this kind of document operations and these official regulations. They are like head pharmacists, and mostly we try to ask them what is the correct point, and then we transfer the information to the patients.
That sounds like there was a lot of collaboration between healthcare professionals, but also challenges of language barriers, documentation. How is everything going to run? But it sounds like they did a great job of explaining it, and everybody stepping up and working together on a true team in order to meet the health and the safety of the athlete at the end. So that's really interesting to hear the behind the scenes of how everything was set up. Would you say is the most surprising or unexpected aspect of working with Paralympic athletes in terms of like healthcare or pharmaceutical needs that you maybe experienced?
When you entered the polyclinic, you never think about a person is Olympic or Paralympic or disabled or non-disabled. Just an individual, and you try to give your all service. You try to provide your service directly to a patient. Because from this point, I think I was really so relaxed and comfortable at this zone, this area, because I already missed, sorry, missed the pharmacy area, and I was really so full concentrated and motivated. The correct word is enjoying the moment. We were at this polyclinic to provide our best service to the athletes, to the other trainers or other support team. So there were also two main kind of prescription type. This means one prescribed from polyclinic, and the other prescription source was the national teams. From the national teams, the physician of the national committee, or if they don't have enough medicines or drugs to dispense to their athletes, okay, they directed them to the pharmacy. First, they prescribed the medicines, then they sent them to the pharmacy. Other choice is because maybe athletes could have some more complicated issues or problems, such as maybe a tooth pain or other problems. In this case, they were visiting the polyclinics. Then they visited the pharmacy with the polyclinic prescriptions. So according to our point, we really never feel any difference. We are almost try to give our best to the Paralympic community.
No doubt about how you would deliver your best. I mean, I'm sure you have contributed a lot to the athletes. And from that point, I would like to ask, because you described the polyclinic very well, you described the overall medical services well, and that you had specific roles about pharmaceutical care to the athletes. How did you integrate your sports pharmacy expertise and training into the athletes' overall healthcare? How did you practice sports pharmacy specifically? And have you seen any positive impact on the performance and the well-being of para athletes that you serve during these days?
As you know, our expertise is improving maybe for last 10 years. And we are also Jess, you, Nilhan, and many other our colleagues. Really, you are giving lots of efforts to develop and enlarge this expertise. And also, we are still looking for the definition of sports pharmacy. I believe that finally we will find the definition. But after this Paralympic experience, I can say that there is really not too much difference between providing a good service from our pharmacies or providing a service for the athletes. But I think the main point is to create a common language with the athletes. All these studies since nearly more than 10 years, I think our all efforts help to improve this language between athletes, trainers, other experts, already parents of the athletes, and really pharmacists are the main bridge of this system. From this point, I can say that in this Paralympic pharmacy service, I mostly try to provide this kind of spatial service according to my previous 25 years pharmacy experiences. Because of this, I was so comfortable, so I feel so relaxed when I was explaining any prescription or any medicine. And also athletes, they also feel about the same position because mostly we are talking about the games, competitions. I was trying to calm them, and because you know they had some problems, and they visited the pharmacy. But we know that okay, maybe the most easiest point is to dispense medicine for a pharmacist. I think the other points are if you can put the other points, such as communication, such as asking, how are you, how is everything? From this point, you build up a very good, useful service.
I love that, Summer. I feel like you and Claire both have really spoken to the experiences you've had as pharmacists in different settings, and being able to carry that knowledge and those foundations forward into working with athletes, and that in the end, these athletes are still human. We know they're human first, athlete second, and that in the end, the importance is going to be on the safety and the well-being of the athlete, and that you make sure that that is what's carried forward when working with athletes, as you would if it was a regular patient when you had a community pharmacy. And then really speaking to highlighting, I think a great job of highlighting the importance of communication and building that relationship with the athlete or the healthcare provider. So I love the narrative you're telling. Neilham and I had done a previous podcast on some of the medical stuff from Paralympics. And one of the things that we highlighted was that the innovations and the advancements that we saw in Paralympians that allowed them to compete at this really high level, whether that be cool prosthetics, wheelchairs, vision pads. Did you see or have any dealings with like innovations or advancements with these athletes that allowed you as sports pharmacy to give a little impact? Were you dealing with skin stuff from like prosthetics or anything like that?
I think yes, a good question and a good point, especially your final words about the skincare. I think mostly they visited our pharmacy about this kind of skincare needs, because for using this kind of prosthesis mostly could cause some skin irritations. But according to my observations, I'm thinking about and just trying to remember these great moments. Or I think the Paralympic athletes, they are really two strong persons, very strong persons. If they didn't have any, maybe at the last point they visited to physician or the pharmacy, because they used to live with the many kind of problems. If they have some main problems, they visited One interesting example I just remember powerlifting athlete. The physician prescribed two prohibited drugs. When we detected that, okay, Mr. Be careful about using this glucocorticoid and this other medicine because they are prohibited. She said that, okay, I don't want to use these medicines. I'm very good. I can delay using these medicines after my competition because they are prohibited in competition. And really, I respect his decision because he felt that he can wait for this medical solution because his competition is the most important thing. We got really proud about for this moment.
With your specific sports pharmacy background, you helped an athlete to avoid an anti-doping violation. I think that's a major contribution, and that may be a standing out moment for you for the entire event. Did you have any specific moments that you would like to share about the Paralympics atmosphere itself, whether in the medical community or the entire athlete village, para-athlete village itself, or the entire games? Any other standing out moment for you from that experience?
One of the polyclinic physician prescribed some drugs. There were a list for the stockage and for the pharmacy content. But this physician just prescribed very unknown drugs, and this kind of combination. For this kind of moments, you need an expert to explain this condition to solve for the correct solution. And I just visited the physician with the patient, and I explained that please, we had the medicines, but you need to prescribe two different medicines to get the same result, the same action. But you preferred a combination. We had this kind of solution. This means the communication was highly important between the other healthcare experts. And one other moment, when for the first day when I was first time entered the pharmacy, polyclinic pharmacy, I realized that there was a paper, and it was about sports pharmacy official accounts, Facebook and LinkedIn accounts, and many of our French colleagues, they didn't know enough information, and they didn't have enough information about sports pharmacy. And I understand that we still have much more. We need much more effort to improve and enlarge our expertise. And also, I understand and I feel that standards about the sports pharmacy education, from starting from the IOC and our other additional educations, really we created a very special and unique expertise. And if you can apply this kind of spatial system directly to this kind of Olympic or Paralympic or major events services, really you can also create the most effective, most valuable pharmacy service for all the sports community.
I love that, Summer. Like, I love the message of, awareness and creating a global health. And I think that really speaks to FIP's World Pharmacist Day that we're talking about on September 25th. what is your message to listeners about World Pharmacist Day and basically promoting global health needs, especially if we're speaking to our listeners who are mostly pharmacists?
Thank you for this also this opportunity. Everything is fastly changing. Before, maybe we can witness this kind of changing in each decade, but for the last 2 years, I think everything is changing day by day. With effect of artificial intelligence and many other technologies. Maybe 2 years before we were always talking about the future pharmacist, but now we are at that point. We have to talk about this present moment and present time and expectations, the treats, the opportunities, and every for the every opportunity when we come together as the colleagues, we need to discuss, we need to talk about this kind of important titles from our expertise point, especially FIP at the end of the 2022, after 8 years from the first statement. In 2012, FIP published a statement about the effective role of the pharmacist in fight against the doping. Okay, after 8 years, we all came together to refresh, to update this important movement and important role. And thanks to FIP's official body, to give this opportunity to our sports pharmacist community, I believe that from beginning of this year, our expertise will increase and enlarge and develop fastly and effectively.
Thank you, Somer. You are a great example of being very aspirational to take sports
Thank you.
pharmacies forward. It's been years that you've put your contribution to this specialty, and now you are picking the fruits and you are being inspiration to me, to many others, to all of us. Thank you for being so persistent. Thank you for never giving up. And we
Thank
hope
you.
that this step of serving in the Paralympic Games is just the next step for you for something bigger. I'm sure that will come and you will make us proud and inspired.
I hope so. At the end of this October, there will be a very important congress in Dubai, FIMS. So I will also present and introduce our expertise to the other experts, mainly sport physicians. If you want, I hope to come together again for a new episode of this great podcast series.
We would love that, Somer. You are our forever guest. I guess there is no way out. You get in one
Thank
time
you.
and we will have
Thank
you
you so much.
again.
You're so kind.
Thank you. And of course, thanks to Claire as well, who were with us just a while ago. Thanks for accepting our invitation. We are lucky to be one of the first ones to hear your special experience. And you gave the experience in such a sincere way that it's inspiring us and it looks achievable if we work hard like you and if we focus on this specialty. Wrapping up our Paris 2024 special episodes where we try to highlight Olympic health, Paralympic health, and how sports pharmacists would contribute into such specific areas. We are grateful to have both of you. And I just wanted to celebrate our special day. Happy World Pharmacist Day to you, to all of our colleagues who are listening us. And we are grateful to have supporters of pharmacists, friends of pharmacists. We call them Pharmily. We'll be going back to our routine episodes in October. And we encourage our listeners to subscribe to our channel so that you won't miss any episodes. So I'm handing over back to my co-host, Jess.
Again, thank you everyone for joining us on this episode, especially Claire and Somer. If you enjoyed this discussion when you're listening, please leave us a review or share the podcast with others. As sports pharmacists, our mission is to provide accurate and evidence-based information to optimize health and performance. When it comes to your health and well-being choices, consult your physician or pharmacist. Always prioritize safety and make informed decision. Thank you for joining us today on the Performance Prescription Lab podcast, and happy World Pharmacist Day.